my name is Dr. Lindsay Oliver, and I'm a pediatrician at Reliant Medical Group's Auburn site, and I'm here today to talk to you about concussions. A concussion is a brain injury that occurs when someone takes a direct blow to the head. We often think about concussions in the setting of high contact sports such as football and hockey, but it really can occur in any situation when someone is directly hit in the head, even from a fall. If you're worried that your child may have suffered a concussion, the symptoms to look for include headache, dizziness, trouble with memory, and trouble concentrating and focusing at school. More serious symptoms to look for include loss of consciousness or vomiting, and those are symptoms where you should take your child to seek medical attention at that point. If you're worried that your child may have suffered a concussion, the most important treatment is brain rest, as this is very important for the developing brain. Your child really needs to avoid any physical activity, avoid going back to sports until their symptoms have improved. They also need to minimize their use of screen time and electronics, and you need to work with your child's teacher to decrease the amount of homework and schoolwork that they're doing until their symptoms have resolved. A lot of people want to know when it's safe for their children to go back to playing sports and rejoin their sports teams. There's something we use called the return to sports or return to play protocol, in which case we recommend that you wait at least 3 to 5 days after your child has experienced the concussion, and then once they've been symptom-free for at least 24 hours with no headache, and without the use of any medication to control a headache, it's fine for them to begin some very light activity, begin jogging, light physical activity, and then each day, as long as their symptoms don't recur, have them continue to gradually increase their physical activity until they're back at full game speed by day 5. And if at any point you're worried about that your child is having a recurrence of symptoms, you need to stop, have them wait 24 hours until their symptoms are gone, and then start over at the beginning again. If you're worried about your child may have a concussion, or you have any questions about whether they can return to sports, you can always ask your child's pediatrician, or you can come see me here in the Auburn office.